For those that were at the last conference and those that have been keeping up on some of what's going on, the Health Insurance Exchange Working Group that's led by Tom Baker and Bob Town has been putting together this matrix of information on what the states are doing with implementation of health insurance exchanges and Medicaid. And part of this has been financed by the Robert Wood Johnson Foundation. And so one of the things, and this is now going up on their website, along with some other data sets that are really tracking what's going on with implementation across 50 states. They want to get more people kind of connected to the data that the Robert Wood Johnson Foundation has helped to fund. So they funded us at LDI, and Janet Weiner is really the one who's going to be leading this, the production and I guess, you know, the production of these data briefs and the writing of these data briefs, which will be in Latin. So this is a mock-up of, we haven't really done these yet, so we just kind of made up the words here. So, because we got the grant actually this week, but one of the things we're working with a group that Robert Wood Johnson works with that actually does all the public relations, and they have a list that they can blast all these data briefs out on. So it's kind of our new generation of LDI issue brief. We're going to do it in cooperation with RWJ and their lists and their ability to get stuff out there. And we're going to focus much more on what's going on with health reform and in particular health insurance exchanges. We're going to try to do these data briefs monthly. And some of the ideas here is really to just improve decision making by bringing empirical evidence and analysis to policy discussions. So really I think of it as you know, bridging the gap between the information that's out there now. A lot of people, there's a huge demand to really know what's going on, and it's mostly journalists that are out there producing the information, and the academics are busy with their journal articles and doing research, very careful research that will be terrific, but I think the demand is now to get some information out there. So we're going to try to bridge that gap by doing some quick spins on the data and bring a little bit of you know, an academic point of view to it, but not really with the same rigor that would take us 2 years in peer review and all that stuff to get done when I think the demand is now for a lot of this information. So the goal here is to bridge that gap with this with these monthly data briefs. We're going to focus on really trying to identify and describe variation that's going on both within states and between states, various aspects of exchanges and the plans and the markets in which they operate. I'm going to try to be timely, transparent, nonpartisan, and factual. Here's a list of some of the briefs that are in the works at various stages, describing health plan choices. We're going to monitor enrollment as a fraction of potential enrollment and correlate that with some of the different things that are going on in the states that have been identified through the Health Insurance Exchange Matrix project. And some of these, we're going to talk about what's going on with outreach and navigators, architecture choices, exchange type, and governance. We're going to, when we get more figures on Medicaid enrollment, we're going to just do some description around that. And then, our goal too is to describe some of the less known exchange regulations that have been collected through the Health Insurance Exchange Matrix. So this is in line with some of the things that we're pushing at LDI, knowledge for policy action. And again, as I described, this bridging gaps. And we want to just draw attention to Penn as an academic center for research on health insurance exchanges and really try to highlight all the amazing things that are going on here at Penn in this area. So that's some of what we're doing. I'll stop there.